In the UK, around 1 in 10 babies start off in the special care baby unit or neonatal unit, including intensive care. There may be many reasons for this, including being born prematurely, they may be one of multiples, or they may have a congenital condition that requires intensive or high dependency care soon after birth. For whatever reason, if a baby is in the neonatal unit, this can be a really stressful time for parents. One of the most positive things that they can do is start to express milk for their baby. Their milk will be the best possible milk for that baby, as it will contain antibodies, it will be exactly the right composition for the gestational age of the baby, and babies are also much less likely to get an often fatal condition known as necrotizing enterocolitis. Now, it can be very stressful for parents to initiate a milk supply in the neonatal unit. It's busy, it's loud, there are lots of monitors and beeping, and above all of that, they're also very worried about their own baby or babies if there are more than one. So there are lots of things that you can suggest to parents that might relieve their stress or help them to feel a little bit more at ease. One of the things they can do is to ask for screens to come around their baby's cot side or incubator so that they can express milk right next to their baby. That might be very reassuring for them. It also helps them to feel more connected with their baby, and it also means that they don't need to leave their baby's bedside if they're worried about them in order to express milk in the expressing room. Another thing they can do is express right after they've had skin-to-skin contact with their baby, which they should be having any time their baby is physiologically stable and well enough, and that they've got the time to sit down and spend with their baby. This is often a time when parents find that they have a lot better milk output because they're relaxed and at ease and they've had a lovely time bonding and nurturing their baby. There are some other things that you might want to recommend, such as having something of the baby's clothing, so a hat or some clothing that the baby's been wearing, and have the mum just smell it, be near it, because sometimes the smell of their baby will help them with their milk production. Or they might want to have a photo of their baby nearby, or think about their baby. If parents are very stressed, I sometimes recommend that they just distract themselves completely, perhaps even by using comedy before trying to express milk with a pump. They should be able to ask for help with expressing on the neonatal unit, and as any other parent will find, in the first few days they will need to initiate their milk supply by using hand expression, and then when they're producing more than about 5 mils of milk each time, they'll probably find it easier to use a pump. And when they do use a pump, they should ask for support with how the pump works, how to get the most out of the pump. And if you click on the video just underneath this video that you're watching now, you'll be able to watch a pump written by Jane Morton and colleagues where they discuss the use of hands-on pumping to maximise milk output in the neonatal unit.